Okay, I've just been made aware of a very interesting development news item here. If we look at Breitbart, they're talking about it. Their title of the article is CDC Chief Agrees There's Perverse Economic Incentive for Hospitals to Inflate Coronavirus Deaths. Now, anyone who's been digging deeper into the whole coronavirus story and what's been going on will know that this is already an idea that's been doing the rounds, although there perhaps it's been mentioned by supposed doctors on social media platforms and so on and so forth, but there hasn't been any real proof. And often I've found myself in a situation of telling people about this, and they say, you don't know who that person is, they might not even be a doctor, and so on. So here we have it. If we go to, I'll include these links at the bottom of the video. If we go to the select subcommittee hearing, the urgent need for a national plan to contain the coronavirus, we can see that Mr. Luetkemeyer, Representative Luetkemeyer, is questioning Robert Redfield, who is the current head of the CDC, Dr. Robert Redfield. Okay, and this is what Mr. Luetkemeyer has to say, and Robert Redfield's response to it. So listen very carefully, because this is amazing stuff that's coming out.
So perspective, to me, is something we always need to consider. One of the things that concerns me also is I wish that Admiral Guar was here yet. I asked this question of him last time was here, and we didn't have enough time to continue our discussion on it with regards to the sort of perverse incentive for the medical folks to claim that somebody died of COVID versus if it's an automobile accident, for instance. As long as you have COVID in your system, you get to claim it as a COVID death, in which means you get to get more money as the attending physician, hospital, whatever. And he acknowledged that the statistics he's getting from the states are overinflated. We found that the governor of Colorado, who is a Democrat, actually did a research on this and found he had to get rid of 12% of the deaths that were recorded in his state. Dr. Redfield, would you like to comment on that a little bit about the perverse incentive, and is there an effort to try and do something different in the way that these deaths are recorded so we actually have better records and better numbers, better data to go with?
Thank you, Congressman. I think you're correct in that we've seen this in other disease processes too. Early in the HIV epidemic, somebody may have a heart attack but also have HIV. The hospital would prefer the DRG for HIV because there's greater reimbursement. So I do think there's some reality to that. When it comes to death reporting, though, I mean, ultimately it's how the physician defines it in the death certificate. In our National Health Statistics group here in Hyattsville, we review all those death certificates. So I think it's probably less operable in the cause of death, although I won't say there are not some cases. I do think, though, when it comes to hospital reimbursement issues for individuals that get discharged, there could be some play in that for sure.
So there you have it. The head of the CDC, the Center for Disease Control, the prime American authority on health, has admitted that there is a perverse monetary incentive for hospitals to put people down as COVID positive, whether it's live patients or on the death certificate.